Research collectively shows that breast milk as opposed to formula is the gold standard for infant nutrition. Choosing to breastfeed your baby is not only the most cost-effective and convenient feeding method, but it also fosters close bonding between mother and child during the first year of life. Breastfeeding can even help mothers shed their pregnancy pounds, but most importantly, breastfeeding is a single choice that you can make as an expecting mother to bolster your baby's immediate and lifelong health in widespread ways. Nutritionally, breast milk's composition cannot be mimicked by any substitute. It has the perfect ratio of the essential nutrients for a hungry baby, including carbohydrates, fats, and protein. In addition to these macronutrients, breast milk transfers high levels of antioxidants, like vitamin C and E, from mother to child. Antioxidants are important because they prevent unpaired electrons in the body from harming tissues. Breastfeeding also transfers stem cells, which are cells that have the ability to differentiate or develop into virtually any human cell. They provide the foundation for human growth and development. The mother's stem cells circle throughout the baby's body to help maintain, repair, and regenerate tissue. Breastfeeding transfers essential immune factors from mother to baby. This is what is called naturally acquired passive immunity, because the baby receives naturally made immune components from the mother. The immune factors contained in the mother's breast milk include, but are not limited to, cytokines, macrophages, leukocytes, enzymes, lymphocytes, hormones, and neutrophils. The beneficial effects of these factors on the baby's body consist of preventing the growth of certain bacteria, reducing the chance of infection, and lessening the damage of inflammation. Inflammation is a major precursor to many diseases that arrive later in life. If left unregulated, inflammation can have harmful effects on the body and health of the maturing child. Together, the mother's immune factors act to initiate and enhance immune development in the growing baby. Breastfed babies also develop a larger thymus. The thymus is a gland found in the body that gives off mature T cells during an immune response. T cells are the body's fighters against foreign invaders. A larger thymus gives off more T cells, which leads to a stronger and more effective immune system when pathogens enter the baby's body. Breastfeeding is proven to protect a growing baby from the progression of potential allergies and diseases. Some examples are autoimmune disorders, pneumonia, urinary tract infections, childhood leukemia, insulin-dependent diabetes, and food or environmental allergies. Formula-fed babies are more susceptible to allergies and developing certain diseases, such as Crohn's disease. Breast milk contains long-chain polyunsaturated fatty acids. These serve as building blocks for immune cells, but also, on a biochemical level, these molecules supplement the baby's neurocognitive development. The brain is where neurocognitive functions take place. Enhanced neurocognitive development leads to an improved ability to think, reason, and learn. Breastfed babies are capable of regulating their food intake at an earlier age than formula-fed babies. This causes the baby to both accept a wider range of food and learn how to control food intake based on natural hunger and satiety signals. Mothers using formula typically feed their babies on a schedule that may not be in sync with a baby's natural hunger cues, often causing habits of overeating when babies eat less frequent but high-volume meals. Breastfeeding prevents these habits and lowers the risk of obesity, diabetes, and high blood pressure during childhood and later in life. The best way to feed your child and bolster their health is arguably to stay as close to the feeding patterns of our evolutionary ancestors as possible. This means breastfeeding directly, without refrigeration or formula substitutes. Cold temperatures inactivate the immune cells in breast milk, so it is more effective to breastfeed directly instead of storing the milk. The first 2 years of life are a crucial window for a baby's optimal development, growth, and health. For the first 6 months of their life, infants should only be breastfed. As babies reach 1 year of age, they reap lower and lower risks of illness and disease, so it may be a good window for weaning to occur. But every mother-child pair is different. The ideal duration of breastfeeding may vary depending on the family, so it is a good idea to ask your doctor what is best for you. You need to be in good health for your baby to be in good health. Before deciding how to feed your infant, you should ask your doctor if you're a good candidate for breastfeeding.